My name is Rudy Palacios. I'm with Trauma Effects. You might have dealt with some of our mannequins here already. I'll show you a couple of our new ones we have. One of them is our canine, canine trainer. Okay. The canine trainer is, actually his name is Hero, right? Lifelike training. Okay. For the, also, you know, in the field, they do get hurt as well in the field. So they need, some of the handlers need to know how to treat the animals out in the field. And this is one of the most lifelike features that we have that you can train with them before you get out there. I mean, it has quite about 8 different features you can do with it. First of all, let me show you some of the features here. It does have a lifelike face, eyes, and tongue, and mouth. Okay. The tongue is actually lifelike. You can actually pull it out when you intubate him. It's the way it's supposed to be pulled out. And you can actually intubate him as well. Okay. When you do intubate him, do it correctly, and you bag him, his chest will rise and fall. If you do not go into his esophagus, if you do bag him, you'll get gastric. His belly will rise and fall as well. Okay, so you do have that. You can do mouth to snout for CPR. If you do it correctly, his chest will rise and fall. And if you do CPR, you do have that. The actual, you can actually do it on. Hero here is has actual skeleton of a real dog inside of him. Okay. He does weigh about 55 pounds, give or take a few pounds here. And when you do pick him up, you can feel it. He's not all stiff. He does droop like a little dog. It is hurt. It will do that. Okay. On the front here, you do have access for an IV. You start an IV here on the front side here, cephalic vein, and you will get a flashback. See again? It's up here in front leg.
Oh, okay.
Usually when they do some IVs on dogs, right here in front.
Oh, I have about 6 minutes.
Yeah, so they usually go for right here. Okay, you can palpate it and you can feel it. Okay. It runs by remote control. This is a pretty simple remote control. Just a few buttons. You turn it on, you turn the pump on. What the pump does, it means it gets the blood circulating to the system. Okay, because he does bleed. And when you do an IV, you can IV flash on him.
Could you use a back leg if you had to?
You can on the back legs. We do have veins, but you can do an easy IO in the back leg if you need. Okay, you can drill easy IO with easy IO into them and run some fluids that way. Yes, sir.
What about on the back? Because I've seen it on the back as well for his fluids.
It's fluids. You mean on the back here, on the chest up back here? We don't have that because a lot of the that's pretty much one of the easiest ways to run fluids to the back. So they wanted us to make it more difficult, so that way the dog handlers or the vets can practice doing the actual more difficult procedures on the dog. Okay. When they put fluids back here, yeah, that is one of the easiest ways to do it. Okay, because pretty much it's easier to show somebody how to do it. They rather go to something a little bit more difficult. Okay. You can do a needle thoracentesis or an NCD on this chest. Okay. The thing about here is you can touch and feel him. He has lifelike fur. Okay. And his paws as well. The realism is actually pretty outstanding. And you come up here and you can touch him if you want. He does have femoral pulses that you can feel right now that are running. With the femoral pulses, you can control the pulses by either slow or rapid rate. All right. To make him bleed, you just click on the button bleed and he'll start bleeding from the wound. Now this is a pressurized wound that was that when you put pressure on it, if you see it, the remote control is flashing red because it's bleeding. If I put enough pressure on it to stop the bleeding, it should go to green. Let me know that I stopped the bleeding. Come on. There you go. See it flashing green now? That means I stopped the bleeding with the pressure. Now it's not going to clot. See, so it has to be a pressurized. So what that does, it teaches the individuals to put on a tight fitting dressing on them to stop the bleed. Again, once all the pressure's on, it will stay flashing green when the pressure's on. If I lose that pressure, it goes back to red. And continue to bleed. Okay. Stop the bleed. Again, you can have a bleed or you can not have a bleed. It's up to you how you want that to run. Okay. Also, in the front paw here, there is an injury that a lot of canines get on the field. Injury to their paws. Okay. And what that does is you can suture it and dress it up. Okay. Now there's a certain way to dress this up that they teach all the individuals, the dog handlers and the vet techs, how to dress up that way the dog is unable to take it off himself. Okay, so that's why that's there. Again, you can run Easy IO and run some fluids on his back tip rib area here. Okay, you can drill into it and run some fluids. All right. He has bilateral radial femoral pulses that you can feel and touch. And also, you can also do, let me show you real quick. Is one of the main procedures is to do a cry. Okay. The skin does separate here, the fur does, just separate it. And when you cut into there, he actually does bleed. Okay. He bleeds and it has tissue, live-like tissue, that when you cut into it, and I'll do a certain cut for you, you can see on camera.
Okay.
Okay. That you can see the different layers of muscle. When you do go into the esophagus and you put your tube in there and bag them, the chest will rise and fall. Again, the skin is replaceable. You just take it off and put a new one on within minutes. He's ready to go. Again, like I said, he's lifelike weight, lifelike feel. You can just pick him up. You see how he feels. There he goes. Hold on. See how he feels like. You pass him around, people can touch his fur, touch his skin, see how it feels like. And look at his mouth, inside his mouth. So he feels like a lifelike dog. Okay. Like I said before, he does have it inside his fur. He has a skeletal of a real dog. Now the socks on his fur, they do come off and they are replaceable. Say they get full of blood and they get too dirty, you can wash them in the washing machine. Throw them with some mild soap and water, and they do wash off.